This video introduction will take you through reviewing a prescription form, which is Lab 6 in your textbook. So the objectives are listed on the lab manual in the exercise 4, as well as in the textbook Lab 6. A written prescription is the primary form of communication between a prescribing healthcare provider and the pharmacy staff in community pharmacies. A pharmacy technician's first responsibility is to process prescriptions, from receiving them from patients to interpreting the data to labeling the bottles. Attention to detail is imperative. Prescription data is presented in the form of a SIGNA. It's a series of abbreviations that begins with an action verb and communicates dispensing and patient directions in this order: the dose, the quantity, the route of administration, the time interval, and then any other additional information. Prescriptions arrive in a variety of ways. They can be handwritten or computer-generated, physician prescriptions, they can be e-scripts, which are known as electronic prescriptions, or they can come through the fax. We also take prescription orders over the phone. Accurate filling of a prescription begins with a careful review of the prescription form for complete data and accurate components, which include the patient, the physician and pharmacy data, SIGNA and DEA number if it's a controlled substance. Check adherence to additional state regulations for prescription drugs and controlled substances, and verify any specific data specific to the electronic prescription, which currently require information about receiving pharmacy and a transmit date. The laws regulating pharmacy practice and filling of prescriptions vary from state to state. Check with your instructor regarding any special exceptions concerning laws, rules, and regulations discussed in this text. Prescriptions for non-controlled substances are valid for 1 year, while those for controlled substances may be valid up to 6 months. That would be for a C2 and a C3. In the state of Louisiana, a C5 is also governed under that ruling. However, national or federal law says that a C5 can be valid for up to 1 year. Prescriptions for non-controlled substances can be refilled for 1 year, while those for controlled substance can be refilled 5 times in a 6-month period. Attention to detail is critical. Many details must be checked on each prescription. Patient data. So we've got the patient name. That includes the patient's address. Also, the patient's date of birth should be on the prescription. The prescriber data should be noted at the top of the prescription, including the prescriber's name, their address, and a contact number. The date the prescription was written is critical. This prescription is now legal for 1 year from the time that it was written. Any drug details, the drug name, strength, this is missing its strength, quantity to be dispensed, and directions. So 1 teaspoon by mouth 3 times a day for 10 days. And then the refills. And if it's not filled in, then it's assumed to be no refills. However, for good practice, it's best that they fill it in. They don't always. And then lastly, a handwritten prescription requires, a signature. The prescription SIGNA, which we call the SIG, describes how a medication should be taken. Directions are written as a series of abbreviations, which are known as SIG codes, always in the same order. So we apply take, or it could be another verb such as give, if it's a parent giving to a child, instill, if it's like eye drops or something like that, or insert. So that action verb, then the dose, the quantity, the route of administration, a time interval, and other information. So here we have take 1 tab, Q6H, PRN, anxiety. And that's your SIG code. So that's a shortened of what's down below. Take 1 tablet, Q is every 6 hours. PRN is as needed for anxiety. Some common signals to know. There's also a table at the back of your book, your lab textbook, to help you with the SIG codes. So QD is daily. PO is by mouth. I'm sorry, I skipped that at the top. PO by mouth. QD is daily, although that's one of the ones that we're not supposed to be using. We're just supposed to write daily. PRN is as needed. Q6H would be every 6 hours. Q4H every 4 hours. And BID is twice a day. So if we look at this prescription, and we're checking everything. So we've got our doctor information, we've got our patient's date of birth, their name, their address. We're missing the date the prescription was written, so something's missing on here. Acupril, 10 milligrams. It should tell us if it's tablet or capsule, so that part is also missing. This should be quantity to dispense. Usually they'll use a hashtag, a number sign in front. 1 by mouth every day. Refills are as needed, and the doctor has signed it. This does not require a DEA number or a license number because this is not a controlled substance. We usually will have the doctor's license numbers on file. So reading the prescriber's handwriting might be a challenge at first, but with experience and with your information and your knowledge of pharmacology, it gets a little bit better. So again, let's review this prescription. So we've got prescriber information. However, they should identify which doctor it is just in case we can't read their handwriting. McCracken, McDowell, not sure. Randall, Phillip, So I would say this is Phillip McCracken. So the date the prescription was written, our patient's date of birth, their name, and their contact information. So this is ciprofloxacin. Again, we're missing tablet or capsule. This is 750 milligrams. It almost looks like it could be 250, but if you know what your medications are, we're going to dispense 28, 1 PO, BID times 14 days. This is pretty bad because I could almost mistake that for a TID. So just some general things, and then the refills as needed. 1 capsule by mouth twice a day or twice daily for 14 days. So let's go over that checklist again. So prescriber information should have name, address, phone, and also their signature. Patient information should include date of birth, name, and address. The prescription information should have the drug, the date it was written, the strength, the quantity, and the refills. Now what is missing on here that it should also have is the dose form. Directions to the patient, the dose, 1, 2 tablets, 5 milliliters, teaspoon, something like that. The quantity, the route, the frequency, and any additional information. So when filling a prescription for a controlled substance, use added caution because regulations governing the separation and dispensing of controlled substances are much stricter than those for non-controlled substances. The quantity prescribed must be written in both numeral form and the word form, 30 and 30, usually with one of them in parentheses, to prevent alteration of the prescribed quantity. If one of the two forms is missing, let the pharmacist know and contact the prescriber's office to verify. Federal guidelines limit the quantity of refills on most controlled substances to 5 for a maximum of a total of 6 fills in 6 months or 180 days. Be sure that a valid DEA number is on the prescription, which now we know how to validate. The procedure for reviewing the prescriptions as they're coming in. So using your current knowledge of the pharmacy practice and information from the textbook and the instructions and the steps that will follow, you're going to evaluate and comment on each prescription to ensure that the required information is included. As you proceed through the numbered steps, you will use the checklist A for each worksheet prescription form. There may be more information to verify on some forms. You must also take the additional steps listed in checklist B for prescriptions that are sent electronically. In cases where the prescription is for a controlled substance, you must take additional steps listed in checklist C. In some cases, you may need to use all 3 checklists. Carefully read over the prescription form and the scenario included below the form. On each worksheet, verify the information on checklist A. If you find any errors or questionable components, mark them by clearly circling them on the prescription form itself. In the space provided under the prescription form, explain the error or errors, or issue or issues, and the best practice to correct them or resolve them. If the prescription was sent electronically, also check the items in checklist B, as you did for the checklist A. Mark the errors clearly on the prescription and write your explanation on the blank lines provided. If the prescription is for a controlled substance, also check the items in checklist C. As you did for checklist A, mark the errors clearly on the prescription and write your explanation on the blank lines provided. The conclusion, you're not going to tear it out.
You will enter your responses in Canvas.
So checklist A. For all prescriptions on the worksheets, check the physician information: name, address, phone number, and handwritten signature. Check the patient information: date of birth, name, and address. Check the prescription information: date written, drug name, strength, quantity, and refill information. Now, technically, they should also have the dose form. They may not have it on these. Oops, I put that in the wrong place. They may not. Please pay attention to that, but we're not going to count that as something that's missing because it's just how this lab book was written. But it is good practice for you to identify, hey, it doesn't tell me, is it tablet, is it capsule? Check the directions to the patient, which is the signa, the dose quantity, route of administration, time, interval, and any additional information. The form sometimes is down in the SIG, so technically it's on there, but new practice has shown to actually put it with the dose of the drug. For electronic prescriptions, you're going to use checklist B. Check the receiving pharmacy information for your pharmacy's name, address, and phone number. Check whether the transmit date is different from the written date. If it is, you may need to call to verify the prescription's validity. And check that the electronic signature is on file. Check whether this electronic prescription is for a controlled substance. If it is, verify with your instructor whether your state allows electronic transmission for such prescriptions. Well, in Louisiana, yes, it does. You just can't send an electronic prescription for a C2. Checklist C is for controlled substances, 3s, 4s, and in the state of Louisiana, 5s. Check to the day's date. Make sure it's within 180 days or 6 months of the day that the prescription was written. Check the validity of the DEA number. Check the quantity, that it's written in both numerical and a word form. Check the maximum number of refills is not greater than 5. Check the quantity. Verify with your instructor whether your state places limits on these substances and respond accordingly to the worksheet. And C5 prescriptions have no federal limit, but our state regulations have it the same as a C3 or C4. So 6 months, 5 refills. Because each state regulates the prescribing and dispensing of prescription drugs differently, you want to make sure that you're aware of the state requirements. All right, now it's your turn. Prescription data presented in a series of abbreviation is called a SIGNA, correct. Prescriptions for controlled substances, that would be all of the above. Must have quantities written in both word and number form, can be refilled a maximum of 5 times, are valid for only 6 months. All of those are true. So in summary, for Lab 6 in your textbook, a written prescription is the primary form of communication between a prescribing healthcare provider and the pharmacy staff. Accurate filling of a prescription begins with careful review of the form for complete data and accurate components. Check adherence to additional state regulations for prescription drugs and controlled substances, and verify any data specific to electronic prescriptions. And use added caution when filling a prescription for a controlled substance.